And now I'm going to turn it over to Rick Shumway, also known as a Steelers fan.
Well, I'm appreciative of being on this illustrious panel, despite Dr. Lim's misguided, support of the Patriots. But I'm sure we can have a good conversation at some point about that. But actually, I appreciated what Darian shared. We are in a unique place. I mean, you look at the panel itself. Amazing organizations doing amazing things in this region, and so we feel very fortunate to be here on the peninsula, supporting the important work that's going on in these communities. And so thank you for having us. We're really excited to be here. So I get to just spend a couple of minutes giving you a little bit of insight into a little maybe behind the scenes on Stanford Health Care. It is an amazing place. I've been here for about 7 years now, and every day I come to work. It is invigorating. It is exciting, really, to see what the future of medicine is going to look like, and the people that we have here, like Dr. Paisley and others, really are shaping that, and it's really an exciting place to be. Notably, I felt like I had to do the obligatory "what is our mission," but it's something we actually believe in here, and our mission is pretty simple. It's healing humanity through science and compassion, one patient at a time. And that's like an ambitious thing to say, is we're going to heal humanity. We're going to do it through science, we're going to do it through compassion, and we're going to do it one person at a time. Missions are supposed to be ambitious. But if there's a place that it can be done, I really believe that it's here at Stanford. Really, really proud of the work that we do every single day. We get a lot of great opportunity and honor to be recognized in different things like, the U.S. News and World Report's Best Hospitals Honor Roll, 11 years in a row. We just recently were designated for the 5th time as a magnet hospital, which is essentially an excellence in nursing designation. There are only 1.6% of hospitals in the United States that have actually achieved that 5 times. And so it's really amazing to see the types of things that are going on here at Stanford Health Care every single day. We'll go to the next slide, and let me just talk you through a couple of the component parts, some of which you may be familiar with. This is Stanford Hospital. We still sort of affectionately think of this as new. It was built in 2019. For those of you who have had the opportunity to be here, it is an unbelievable facility. We call it 500P, that's 500 Pasteur Drive here in Palo Alto. And what I love about this is, well, there's so many things, but it's one of the most, if not the most, technologically advanced hospitals in the entire world. When we built it, we did so in partnership with Google and with Apple, with NVIDIA, all of the great organizations that surround us here in this area. And I think if you come here, you experience that. It really is an amazing place where amazing things happen every single day. If you go to the next slide, it's important, of course, that we have the great technology. It's important, of course, that we have the great people. But the most important thing is that when you come here, you know that you are getting the highest possible quality care that you can get. And I'm really excited about what happens here every single day, because we look at our quality and accountability through a lot of lenses. But one of the things that we measure ourselves against is all of the other large-scale academic medical centers across the country. And we look at our aggregate quality measures and make sure that we're tracking appropriately. And just recently, in the last month or so, we were recognized in the top 5 academic medical centers in the country for quality and accountability. It really is an amazing thing to see what happens when our patients are able to come here and get the care that they receive. I couldn't get through the presentation, certainly, without talking a little bit about the innovation that we have here. AI, nobody said it yet. I'm surprised. I feel like I can't get through any conversations on healthcare these days without talking about AI. All of our organizations are working on these things. But I'm really excited that here at Stanford Healthcare, we're developing some of the frontier-based applications of AI in a very responsible and safe way. One of my favorite things recently is we've developed essentially we call it chat EHR. And it's like Chat GPT for our physicians and providers. But what they're able to do is actually go into the medical record and ask it questions. When you think of medical records, they can be big and onerous and deep and complex and sometimes hard to navigate. So our physicians will have to go back through lots of records and figure out what's going on. We had a patient recently that was struggling with a diagnosis that was very, very complex. And the pathologists used our chat EHR function that we've developed and built here to query the medical record. And it actually found an obscure lab from 7 years prior that identified the actual clinical issue that all of our physicians were struggling to identify. And it changed the course of our patients' care delivery. Really exciting. Another example of how we use this is for our clinical trials. That's one of the things that I think is distinct and sets us apart is our ability to offer those to many of our patients in all of our specialties. And we actually queried the chat EHR function to identify patients that were qualified for a really advanced clinical trial. We found 7 patients off the bat that we were able to offer this to as a therapy to help in their care. Really exciting to see what's happening around the innovation side of things. If you go to the next slide, this is something that we are exceptionally committed to. It's great that we're here in Palo Alto. It's amazing what we have to offer to our communities through the mechanisms here at 500p. But long gone are the days when people are just going to come to Palo Alto. There are a tremendous number of needs and resources that exist well beyond this community. And so we firmly believe that we need to be where people actually are. And you can see sort of our network and our development of that network over the course of time. You know, over 80 ambulatory care locations. We have large scale centers anchored in different parts of the Bay and the San Jose area, in the Tri-Valley and the East Bay, and certainly, of course, over here on the peninsula. Very important to make sure that we're actually where people are, that they can access all of the things that I just described if you're in Pinole, or if you're in Los Gatos, or if you're in Palo Alto. And it's really important that we do that. But the other thing that I'll just say is it's not for us just about putting down buildings and putting services in communities. We sincerely seek partners. We know that we aren't going to be able to solve all of the issues in all of the areas on our own, nor should we. We want to partner. We want to be connected to the people that are in these communities that actually know what the issues are. So we've got a lot of interesting partnerships. A couple of them I'll highlight. Dignity Health, we have a great partnership at Sequoia Hospital there in Redwood City, where we operate a 24-bed inpatient unit since May of 2024, which encompasses inpatient access to all Stanford services in Redwood City. We have our cardiothoracic surgeons that operate out of that site as well. Really amazing opportunity to partner with a great organization like Dignity Health and Sequoia Hospital. Sutter Health, we have amazing partnerships with. We are getting ready to open our Stanford Sutter Cancer Center in Oakland, which will open late next year to really serve that population in a really meaningful way by combining the power of both of those organizations. I look at my colleagues on this call and I think back to the good old days of early COVID and the partnerships that we were able to develop with Sutter, with Kaiser, and many others across this particular region to service the communities that we all collectively care about. Really is what keeps our engines running. And then, of course, many community health and support organizations that we partner with, which is really great. The last thing that I'll just share with you is a little bit about what is going on in Redwood City. If you can go to the next slide. This is something that we are exceptionally proud of and we're exceptionally excited about. We've been in Redwood City in a meaningful way for the past 15 years with our large-scale multi-specialty outpatient center there in Redwood City. It includes over 50 Stanford specialties, access to clinical trials, all of the services that you might need in terms of imaging, therapy labs, et cetera. And for those of you who drive back and forth on 101, you will see steel coming out of the ground. We are really excited to expand those services with a new building opening in 2027, which will incorporate many of our other services like cardiovascular health, women's health, and LGBTQ plus health. Really exciting to see that coming together. What I'm exceptionally excited about is the opportunity that we are discussing about establishing, and I'm going to use the word world-class cancer center in Redwood City on that same campus. We're in the very early stages of this. We're currently in the process of gaining a lot of input and discussion from across the community as we develop what this vision could be. But we really believe that this will set the standard for cancer treatment across the world. It will happen in Redwood City, and we're really excited about it. We're excited that we'll be able to integrate all of the clinical, all of the research, all of the development and integration into one place, which is going to really shift, again, the course of cancer treatment. To do so, we are working very, very closely with our city, our county, our community leaders to make sure that we understand the needs of the community and that we're meeting the needs of the community as we go through that process. And so again, we're in such early stages of this. When I'm finished, I'll put a link in the chat for those of you that are interested in what's going on here. But it'll give you more information about this, but we're really, really excited about what that's going to look like. The end of the day, I think we're going to talk a little bit about challenges. They are ever present in healthcare, whether those are federal or state policies or access to care or social drivers of health. There are a lot of things that we're all trying to deal with. But we at Stanford believe that we are best positioned to address those things as we continue to partner with those that are around us and that are in the communities, that understand the communities, and that know what is going to be necessary for us to be able to enhance the work that's going on in every day that is so impressive. So thanks for having us. We're excited to be here, and I'll pause there and move on to the next section.